Assalamu alaikum wa rahmatullah. I am Assistant Lecturer Lamia Hadi. I will talk about the embryogenesis of the urogenital systems. At the end of the lecture, you should know about the stage of the kidney, the functions and the anatomy of the development kidney, development of the urinary bladders and the urethra, and the clinical correlate of the kidney and the bladder. And functionally, the urogenital systems can be divided into completely different compounds: urinary systems and the genital systems. Both urinary systems and the genital systems develop from the common mesodermal ridge, or is called the urogenital ridge, that the intermediate mesoderm, located on the other side of the aorta. You can see on the other side of the aorta, along the posterior wall of the abdomen cavity. Initially, the excretory duct of the both systems enter in common cavity. This cavity is called cloaca. First, urinary systems or kidney systems. There are three systems development from the intermediate mesoderm, forming anteriorly to posteriorly. These systems are pronephros, rudimentary and non-functional. Second, mesonephros, functional for a short time during the early fetal period. And third, metanephros, forming the permanent kidney. Okay, pronephros, mesonephros, and metanephros. Initially, the pronephros. Pronephros is most anteriorly systems. Excretory unit is called the nephratomes, beginning at the 4th week in the cervical regions, representing by 7 to 10 solid cell groups. These groups form vestigial excretory unit. A nephratome that regress before more caudally ones are formed. In the end of the 4th week, all indications of the pronephric systems have disappeared in the craniocaudally sequence at the cervical regions. You can see. The second systems of the urinary systems in mesonephros. The mesonephros and the mesonephric duct are derived from the intermediate mesoderm, from the upper thorax to the upper lumbar segment. Early in the 4th week of development, during regressions of the pronephric systems, the first excretory tubules of the mesonephric appear. In the pronephric systems, the vestigials of the excretory unit, but in the mesonephric, the excretory tubules appear. The excretory tubules or nephratomes lengthen to form a C-shaped loop. You can see this is the C-shaped loop, and acquire a tuft of capillaries that will form a glomerulus at their middle end from the dorsal aorta. You can see this is the tuft of the capillaries. the glomerulus, the tubules form Bowman's capsules, and Bowman's capsules with a glomerulus now is called the renal corpuscle, or is called the excretory unit. Okay, glomerulus, tuft of the capillaries, surrounded by two layers of the Bowman's capsules, Bowman's capsules and the glomerulus forming the renal corpuscle or excretory unit. Laterally, these tubules enter the longitudinal collecting duct, is called the mesonephric duct or Wolfen duct, that is connecting caudally with cloaca. Okay, first forming to the C shape, enter the glomerulus, tuft of the capillaries, and these glomerulus surrounded by Bowman's capsules, two layers, parietal layer and visceral layers, and these tubules laterally, longitudinal, and forming the mesonephric or Wolfen duct. الولفن duct or mesonephric duct connect in the middle of the second month. The mesonephros form a large ovoid organ on each side of the midline. Okay, in the middle of the second month. Since the development gonad is on its middle side, the ridge formed by both organs, اللي هي urinary and gonad, is known as urogenital ridge. While caudal tubules are still differentiating, the cranial tubules and the glomeruli show degenerative changes. By the end of the second month, the majority have disappeared. إذن راح تروح عندنا الميزونفروس، الوقت مالتها شو وقت راح يكون؟ بالend of the second month. In the male, a few of the caudal tubules and mesonephric ducts persist and participate in the formations of the genital systems in the male. A few of the caudal tubules and the mesonephric duct forming the genital systems, but they disappear in the female. The third systems of the urinary systems, the metanephros, or is called the permanent kidney or definitive kidney. These kidney appear in the fifth week. The excretory unit develop from metanephric mesoderm in the same manner as in the mesonephric systems، واللي هي احنا عندنا التيوبيولز elongated forming a C shape. A C shape enter to the tuft of the capillaries forming a glomerulus. The glomerulus surrounded by two or double layers of the Bowman's capsules. Bowman's capsules and the glomerulus forming to the renal corpuscle, and these tubules laterally elongated and forming to the mesonephric duct. The development of the duct systems differ from that the other kidney. And then a difference between and the duct systems. The kidney develops from two sources. The first, urethric buds, which give rise to the collecting systems. Then first, urethric buds forming to the collecting systems. A second, metanephric mesoderm, or is called the metanephric plastema, which provide excretory units. Then, the urethric bud forming to the collecting systems, while the metanephric plastema forming excretory. The kidney development from outgrowth of the caudally mesonephric ducts. This is the urethric bud. At the fifth week, caudally of the mesonephric duct forming the urethric bud, and from the condensations of the nearby intermediate mesoderm, the metanephric plastema. Its excretory tubules or nephratomes form a renal corpuscle in the same manner as the mesonephros. But the collecting mesonephric duct is replaced by the urethric bud. The collecting duct of the metanephros development from the urethric bud. The urethric bud project from the mesonephric duct. The bud penetrating the metanephric plastema and dilated to form a renal, you can see a renal pelvis. A renal pelvis divided to form the major calyx. Each calyx form two new buds while penetrating the metanephric tissue. You can see البud راح يكون penetrating to the mesonephric duct forming the renal pelvis. The renal pelvis divided to form the major calyx. The major calyx also divided forming two new buds while penetrating the metanephric tissue. These buds continue to subdivide into 12 or more generations of the tubules have formed. You can see in the meantime, at the periphery, more tubules form until the end of the 5th month. The tubules of the 2nd, 3rd, and the 4th subdivided, fused together, form a minor calyx of the renal pelvis. The collecting tubules of the 5th and the successive generations forming a renal pyramidal, and the stalk of the urethric bud become ureter. Okay? The urethric buds give rise to a ureter, renal pelvis, the major and the minor calyx, 1 to 3 million collecting tubules. The excretory systems, each nearly forming collecting tubules is covered at the distal end by الميتانفريك tissue cap. You can see the collecting tubules induce these cup, and cells of this tissue cup form the renal vessels. You can see that elongated to form C-shaped excretory tubules. Capillaries will grow into the pocket at one of these C-shape and differentiated into glomeruli. You can see C-shape grow into the pocket at one of the C-shape and differentiated into glomeruli. These excretory tubules together with their glomeruli is called the nephron or excretory unit. والنفرون include the proximal convoluted tubules, distal convoluted tubules, and the loop of Henle that are connecting distally with the adjacent collecting tubules. You can see this is the collecting tubules. The proximal end of each nephron forming the Bowman's capsules. Continuous lengthening of the excretory tubules result in the formations of the proximal convoluted tubules, loop of Henle, and the distal convoluted tubules. Again, the excretory systems or excretory unit forming the each collecting tubules penetrating to the metanephrine tissue cup and forming the cells of the tissue cup forming to the renal vessels elongated forming to the C shape. The C shape will enter the glomerulus, enter capillaries and forming to the glomerulus, and elongated forming to the distal convoluted tubules and loop of Henle والproximal convoluted tubules. The end of the proximal convoluted tubules forming to the Bowman's of the capsules. Here in these pictures you can see this is the collecting tubules surrounded or covered by cup. Cells of these cup tissue forming to the renal vessels elongated and forming to the C shape. C shape enter to the capillaries and forming to the glomerulus and continuous to the forming tubules elongated and connecting with the collecting duct. all the glomerulus and الدستال وproximal والloop of Henle and the Bowman's capsules is called the nephron or excretory unit. The functions of the kidney. Although the definitive kidney become functional near the 12th week, but urine producing beginning after the formations of the glomeruli in the 10th week. The urine passes into the amniotic cavity and mixed with the amniotic fluid. The fluid swallowed by the fetus to be recycled through the kidneys. The excretions is a function of the placenta, not the kidney. The anatomy of the developing kidney. The excretory unit of the nephron. The nephron consists of the glomerulus, pons of the capsules, proximal, distal convoluted tubules, and the lobe of Henle are continuously developing until birth to be about 1 million in number. While postnatal growth in size of the nephron contribute to a disappearance of the fetal lobulations of the kidneys. Initially, the kidney developing in the pelvis. However, the growth of the lumbar and sacral regions and the dimensions of the body's curvatures causes ascending of the kidney up to pass in between the arterial fork of the umbilical arteries. The kidney are vascularized during their ascending by new branches from the aorta at a high level. The lower vascular branching degenerates. In these pictures you can see the ascending of the kidney. The kidney developing in the pelvis initially, and growth of the lumbar and the sacral regions of the dimensions of the body curvature causes ascending of the kidney up. You can see. The clinical correlates first Williams tumors. Williams tumors, a cancer of the child kidney due to the gene mutations. Then Williams tumors caused by gene mutations. Second, congenital polycystic kidney. Congenital polycystic kidney occurs due to obstructions in the urine path from nephron to the collecting tubules. You can see this is the polycystic kidney caused by obstructions in the urine path from the nephrons to the collecting tubules. Another clinical correlates renal agenesis, or is called the dysplasia. Occur due failure of the inductions by the ureteric bud to the metanephros, either unilateral or bilateral. Another clinical correlates duplications of the ureter. Duplications of the ureters due to early splitting of the ureteric bud. Ectopic ureter opening, really one of the ureters opening into the vagina, urethra, or vestibules. More clinical correlates pelvic kidneys. The kidney is still in the pelvic, occurring due to the failure of the ascending kidney. Horseshoe kidney occur by fused of the lower poles of the kidneys as the poles, causes pushed close together during the passage of the kidney through the fork of the umbilical arteries. The ascending horse show kidney stop at the root of the inferior mesentery artery at the lumbar 3. The ureters pass anteriorly into the isthmus of this kidney. Lastly, the accessory renal arteries occurring due to the failure of the degenerations of the embryonic artery during the ascending of the kidney. احنا قلنا الكدني من تكون بها الاسcending راح تكون vasculars by a new branching from the aorta at the high level. والlower vascular branching of the kidneys degenerations. فإذا ما صار بها degenerations failure of the degenerations راح يسبب لنا بها الأكسسوري renal arteries. Now the urinary bladders and the urethra. The urogenital sinus consists of the three parts. First, urinary bladders that the upper portions and the largest part. Second, pelvic part of the urogenital sinuses, narrow canals. And third اللي هي تمثل لي الفلك part of the urogenital sinuses flattened. The first part of the urogenital sinuses, urinary bladder, the large upper part and connecting with the allantois. The allantois is obliterated later on, forming a fibrous cord between the bladder and the umbilicus, called the uricus or median umbilical ligament. The mesonephric duct are opened into the part of the cloaca. The caudally part of the mesonephric duct is absorbed in the wall of the bladder to form the trigone of the bladders. You can see. As a result of the change, the urethric bud originating from the mesonephric ducts become connecting with the trigone of the bladder. Then after the opening of the mesonephric duct move together and become connecting to the prostatic urethra, forming the male ejaculatory duct. The trigone forming a result is absorbed in the wall of the bladder in the caudal part of the mesonephric duct. Now the trigone acquired a transient mesodermal lining from the mesonephric tissue, which is replaced later on by the endodermal lining. The same of the lining of the whole bladder. Here you can see the mesonephric duct, and this is the urethric part later forming to the ureter, and here you can see the trigone of the bladders forming from the الcaudal part of the mesonephric duct result absorbed in the wall of the bladders, and later on the mesonephric tissue from the trigone replaced by endodermal tissue that the same lining of the whole bladder. The second part of the urogenital sinuses, the pelvic part. The pelvic part is a narrow canal, will form prostatic and membranous urethra. Prostatic and membranous urethra in the male. The urethra lining by the endodermal organ, while the connective tissue and the muscle surrounded it is derived from the splenic mesoderm. At the end of the third month, the prostatic urethra show many budding, forming the male prostatic. The pelvic part forming the prostatic and the membranous urethra. The urethra lining by the endodermal origin, while the connective tissue and the muscles are surrounded, derived from the splenic mesoderm. At the end 3 months, the prostatic urethra show many budding, forming the male prostate. In the females, budding from the cranial part of the urethra, forming the urethral and the paraurethral gland, while in the male, budding of the urethra forming the male prostatic. A third part of the urogenital sinus is the phyllic part. It is flattened from side to side. The tip of the rectal septum will form the perineal body. The clinical correlates from the bladder defect. First, urethral fistula. It's occur due to failure of the obliterations of the uricus. Uricus forming from the elentus. Elentus is obliterate, forming the fibrous cord between the bladder and the umbilicus. Urine will outflow from the umbilicus. Partially failure will result in urethral sinuses or urethral cyst. The second clinical correlate from the bladder defect, the extrophy of the bladder. Extrophy of the bladder is a ventral body wall defect in which the bladder mucosa is exposed outside. You can see this is the bladder exposed outside. These anomalies are rarely occurring in the 2,100,000 live births. Thank you.